Coronavirus disease 2019, or COVID-19, is an infectious disease caused by SARS coronavirus 2, or SARS-CoV-2. It was first identified in December of 2019 in Wuhan, China, and has resulted in the ongoing COVID-19 pandemic. Common symptoms include fever, cough, fatigue, breathing difficulties, and loss of smell and taste. But other symptoms can occur, including a sore throat, chills, muscle or joint pain, a wet cough, diarrhea, headaches, and abdominal pain. Most cases are mild and do not need hospital care. However, some infections lead to viral pneumonia and the failure of the respiratory or other body systems. For those cases, hospitalization is frequently needed for breathing support, with oxygen or a mechanical ventilator, along with therapy to support the circulatory system, kidneys, and other body systems. As of 1 March 2022, more than 437 million cases have been reported in countries and territories, resulting in over 5.95 million deaths. More than people have recovered. It spreads very easily and sustainably, primarily through contaminated air or droplets produced during breathing, coughing, sneezing, talking, and singing. Less commonly, when the contaminated droplets fall to floors or surfaces, they can remain infectious if people touch contaminated surfaces and then their eyes, nose or mouth with unwashed hands. Some people have been infected and recovered without showing symptoms, and such people may be able to spread COVID-19. The average time from exposure to onset of symptoms is 5 days, but it can vary from as little as 2 days to as many as 14. The standard method for diagnosis of active COVID-19 infection is with a swab of the back of the nose and back of the throat, which is then tested for the virus using a polymerase chain reaction, or PCR, process or a rapid antigen test. The infection can also be diagnosed from a combination of symptoms, risk factors and a chest CT scan showing features of pneumonia. Preventive measures to reduce the chances of infection include staying at home, wearing a mask in public, avoiding crowded places, keeping distance from others, washing hands with soap and water often and for at least 20 seconds, practicing good respiratory hygiene, and avoiding touching the eyes, nose, or mouth with unwashed hands. The use of face masks is recommended for anyone suspected of having the virus to prevent the spread of infected droplets. Caregivers and the general population should also use masks, face shields, and other personal protective equipment when caring for people with active COVID-19, with high filtration masks, like the N95, being best. There are multiple effective vaccines and a number of specific antiviral treatment for COVID-19. Management involves treatment of symptoms, supportive care, isolation, and experimental measures. The World Health Organization declared the COVID-19 outbreak a public health emergency of international concern on 30 January 2020, and a pandemic on of March 2020. Local transmission of the disease has been recorded in nearly all countries across all 6 WHO regions.